The knee joint is specifically this area where the femur bone comes to meet the tibia bone. They don't actually touch, or at least they shouldn't. The reason that they don't touch is because the knee joint is what's called a synovial joint, just like the shoulder joint. A synovial joint has a bit of cartilage and synovial fluid between the two bones. So imagine now that this was my femur bone and this is my tibia bone. If they were to press upon each other, that would mean arthritis for most people. Compressing the bones together, or an inflammation inside at one of the connective tissue areas, can mean a painful type of arthritis. Osteoarthritis has been said to affect about 1/3 of all American adults. It's a real big problem. Arthritis affects the knees and the hips more than anything else. The reason for that is these are weight-bearing joints. Gravity is pulling us down and weight is pushing into our hip joint and our knee joint. So that's why yoga is so great to keep us free of arthritis. So I want to start with just the basic idea of what the knee joint is. What are the basic structures? We have connective tissue that keeps the knee joint stable. Specifically, we have 4 ligaments. What is a ligament again? Connects bone to bone. So within this knee capsule, capsule is this open space, we have 2 ligaments that are deep inside, which you'll never see or feel, and 2 ligaments which are on the outside, which you can feel, but it's a little hard to locate. The ligament that is hurt or torn most often in life and in sport is called the ACL. You might have heard of ACL damage. That's known as the anterior cruciate ligament. Anterior cruciate ligament, crossing over from one side to the other. Behind that one, we have the PCL, the posterior cruciate ligament. So what does cruciate mean? It means to cross. It creates an X. The anterior cruciate and the posterior cruciate will crisscross. That's what cruciate means. These ligaments are very, very important to keep the stability at our knee joint. If either of these ligaments tear, even just a little bit, our knees are not going to work properly. When does our ACL tear mostly? Well, the most common tearing of the ACL is in downhill skiing. Because if you can visualize downhill skiing, our ankles are locked in place. We often buckle to one side when we fall, and the anterior cruciate ligament is compromised or torn. That's why it's such a common injury. It can also be torn when you're running. A lot of runners with bad alignment or weak quadriceps could get ACL tears. Many different reasons, but mostly skiing. In yoga, however, in most yoga postures, you do not put too much pressure on the ACL. The ACL is rarely injured in yoga. That's good news. We'll come back to another portion of the yoga problems later, however. Now, on the outer edges, we have what's called the collateral ligaments. This is the inside of our knee. This would be called the MCL. MCL is medial collateral ligament. On the outside, we have the LCL, the lateral collateral ligament. Again, this is a mouthful, but a very simple concept if we think about it. On the inside, we have the tibia, and the femur is here. So the MCL just goes from here to here, stabilizing the side. The LCL goes from the outside, the fibula, to the femur. LCL, fibula to femur, MCL, tibia to femur. When are these ligaments most needed or active? Well, when we start to do side-to-side movements, going one side, the other, especially the outer edges of the LCL. If you can think of a soccer player or a football player, Someone who tries to fake out an opponent, going one side and the other, trying to throw off their opponent, they're putting a lot of pressure on the edges of their knees. And after many years of that kind of pressure, often you get micro tears. The outer edge of the knee, the LCL, can get little micro tears until it can be a little painful or become a trick knee. So that's a problem with those type of sports injuries. In yoga and Pilates, we don't generally get problems because of those type of postures in the ligaments. It's pretty safe. Where do we get problems? In yoga postures, especially the more advanced postures for the knee, we do what's called lotus or half lotus. Let me demonstrate. So in half lotus position, we take our foot over our thigh bone as high as we can, and we want to see the knee drop down. What's happening here is that the bones are coming closer together. As I mentioned earlier, we have cartilage between the bones. The cartilage is called the meniscus cartilage in the knee joint, the meniscus, or menisci for the two, the plural, because we have one inside and one outside. What happens in yoga to some people, if we're not doing it very slowly and consciously, is that we yank ourselves into this position, pushing up and down, the heel up, the knee down, and the bones come together. That is very problematic. What will happen is that the medial meniscus can actually get crushed to some degree by these two large bones. You can tear your medial meniscus. It is much more common than most yoga teachers would like to admit. We like to think of yoga as being completely healthy and good for the body. Unfortunately, when we force ourselves into half lotus or full lotus before we're ready for it, because our hips are too tight, or even our knees are feeling a little cold or tight, we tend to tear the medial meniscus. And unfortunately, the meniscus does not get much blood to it. Actually, the cartilage gets no blood or nutrition, so it doesn't heal. The surrounding synovial fluid, as it's called, has nutrition. So this is a synovial joint. We have what's called fluid inside. The fluid at the synovial joint, whether here or at the shoulder, it resembles the white of an egg. That has the nutrition, and that nutrition can somewhat be fed into the cartilage. But as most surgeons will tell you, once you tear your meniscus, there's very little chance of it healing completely. So we really want to be careful. We only want to come into lotus-type postures when our hips are very flexible. All movements of our knee begin at the hip. Let me say that again. Anytime we're coming into a knee movement, whether here, 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 or back, it all starts somewhere at our hip muscles. So if we're doing half lotus, and our knee only drops down, our knee only drops down this much, odds are we're not really ready for it, because either the back glutes or the front hip flexors are not flexible enough to let it drop. More often than not, the hip flexor muscles. This space is shortened and we can't lower the knee. And that's where we're putting ourselves in a very dangerous position.